Aeroflow Urology makes accessing incontinence supplies like adult briefs, pull-ons, underpads, and more simple, affordable, and stress-free. Aeroflow delivers directly to your home every month at no cost through insurance for adults and children aged 3 and up. Their dedicated continence care specialists guide you every step of the way. And as a high-trust certified provider, Aeroflow has helped over 2 million people save hundreds of dollars every month. Ready to see if you qualify for free supplies? Visit aeroflowurology.com/NAFC to complete a quick 2-minute form and know if you're eligible in minutes. That's AEROFLOW urology.com/NAFC. Have your insurance card ready and let Aeroflow handle the rest. Coverage requirements do apply. Urinary tract infections are incredibly common, but many of the symptoms that people attribute to a UTI may actually be caused by something else. So in this episode of Life Without Leaks, we're sitting down with Dr. Jannah Thompson, a board-certified urogynecologist, to separate fact from fiction and to help you find real relief from what's ailing you. So let's get going. Welcome to Life Without Leaks, a podcast by the National Association for Continence. NAFC is America's leading advocate for people with bladder and bowel conditions, with resources, connections to doctors, and a welcoming community of patients, physicians, and caregivers, all available at nafc.org. Welcome back to another episode of Life Without Leaks. I'm your host, Bruce Cassover, and joining us today is Sarah Jenkins, the Executive Director for the National Association for Continence. Welcome, Sarah.
Thanks, Bruce.
Today we have joining us Dr. Jannah Thompson. She is a friend of the podcast. You may recognize her from a number of previous episodes. She's a board-certified urogynecologist and urologist practicing with Trinity Health in Grand Rapids, Michigan. Welcome, Dr. Thompson. How are you?
Good. How are you? Glad to be back.
Yeah, thank you. We're glad to have you because today we're going to be talking about a topic that really seems to be on so many of our visitors' minds, and that's UTIs. What is a UTI? When is a UTI not a UTI, and what can you do about them? So maybe you want to give us just a little idea. First of all, what is a UTI? People know they have them, but they don't even know what they are necessarily.
The definition of a urinary tract infection or UTI is that a patient has symptoms, specifically burning, frequency, incontinence, low pelvic pain, and culture evidence or culture proven evidence of a bacteria. So if somebody's having these symptoms and they see their physician, what should be ordered is a urinalysis and a urine culture. Because unfortunately, the symptoms of burning frequency, incontinence, lower pelvic pain can be the sign of other things that we treat. So if the culture comes back showing a single organism, it's not contaminated with several bugs or bacteria, it has a single organism, and the urinalysis shows more than 10 white blood cells, that by definition is considered a urinary tract infection. Now, the number of bacteria are also important when determining if somebody has an infection. So the American Urologic Association, or the AUA, has criteria or best practices around how to treat urinary tract infections. And it is considered 50 to 100,000 is considered a diagnostic of a urinary tract infection. Again, when it is a single organism and when there is at least 10 white blood cells. Now, if there's less bacteria than that, or there isn't 10 white blood cells, that is not an infection, even if there is bacteria in the culture. So once we have that, then the treatment would be a short course of antibiotic, but there can be other factors that could cause bacteria in the urine. Sometimes people have catheters, which can cause bacteria. Some people can have bacteria in the urine and not have symptoms. So again, the key components are that there's symptoms and that there's evidence on a culture of bacteria. Now, there are several ways that we can prevent these infections, which we can talk about in a second. But I want to back up a second on other symptoms that occur that patients often get worried or concerned about, and that can be foul odor or cloudy urine. So when the urine is cloudy or foul urine and there's not burning or frequency or worsening incontinence, that by itself is not a symptom. That is typically something that can clear up just by pushing more fluid. So there really needs to be more than just cloudy urine or foul odor for being symptomatic urinary tract infection. Some people say, I just don't even know that I have them, and then they find them. So what gets confusing is that as we age as women, it is well known that many of us can have bacteria in our urine and not really have symptoms at all. And that is asymptomatic bacteriuria, again, meaning no symptoms, but bacteria in the urine. And that's okay. It's not harmful. We don't need to do anything about it. So if on a routine urine test, bacteria is found, but you weren't experiencing burning or frequency or worsening incontinence or lower pelvic pain, I would not treat with an antibiotic. And the reason is that we can develop resistance to the antibiotics that we have. And over time, it can become more and more challenging or difficult to treat. Or we can start to grow what we call superbugs, which are bacteria that sort of grow despite the antibiotics. So we really have to be much more careful as a medical community about who and when we give antibiotics to.
So if you're experiencing some of these symptoms, what can you do about it? Can you take care of it yourself at home? The internet is full of home remedies or alleged home remedies. But I also know that you talk about antibiotics and things that need to be prescribed. What do you do? And how do you make your decision about which path you go?
I think most people are worried when they have these symptoms that could it turn into something worse, right? Could they become septic where their blood pressure lowers and they get fevers and a high heart rate? Those are signs of sepsis. And that is actually very rare with a urinary tract infection. So most urinary tract infections, if you're willing, can be what we call self-limited, meaning they can go away on their own without antibiotics. And that would involve basically flushing the bacteria out. So drinking a lot of fluid, mostly water. Some people like to do cranberry because there's some evidence that cranberry helps. So whether you do cranberry juice or water, I think it's really just the act of flushing that bacteria out of the bladder. There's several over-the-counter products like AZO or the prescription form of Pyridium. These are the medicines that turn your urine orange. And those kind of help take the sting out of the urine so you can tolerate it a little better. Many patients don't want to wait that long, though, because it's not comfortable, right? Maybe these symptoms are waking them up at night. Maybe it's really painful to urinate. So if using water to flush it out and maybe over-the-counter azole, you're just still miserable, that might be the time to reach out to your physician about getting a culture and then looking to see if there's bacteria. There are other over-the-counter products, though, that I think are helpful for prevention, which we can talk about. But those would be something that you can do yourself easily, which is the fluid and the AZO over the counter to help with symptoms, even actually Motrin or ibuprofen because they're anti-inflammatory. If you are okay to take those, that would be another class of medicine over the counter that's helpful.
So I want to ask you about cranberry, by the way, because you mentioned how there is some evidence for it. That is always like the go-to for so many people that everyone, they've heard it from their mother, who heard it from their mother. There really is evidence, or at least limited evidence, that cranberry is helpful.
So the reason why there's some evidence is that the evidence is mixed. There's some studies that show it's helpful, some that don't. What the component in cranberry that seems to be helpful is a molecule called PAC. And PAC is a molecule that prevents the bacteria from adhering to your urinary tract. And so that is obviously something that we want, but oftentimes the concentration of this PAC isn't high enough in your over-the-counter cranberry forms, whether that's cranberry juice, cocktail juice mostly has sugar. So we're talking about concentrated cranberry or your cranberry tablets. But there are some companies, one of them being Soul Wellness, who has concentrated this PAC to 30 times the amount that you find in cranberry supplements. And that medication is called Jannah, Gennamd, Jannah MD, and it is a supplement that you can take daily to help with prevention of urinary tract infections. And that's something that I often use. I believe Costco also has a cranberry supplement that has a very high concentration of PAC. Fortunately, I don't know the name of it, but I am aware that it is out there. So I would look for, again, PAC in any of the cranberry supplements and look to see that there's a high concentration of that.
Okay, very good. Now, in addition, so there's maybe some home remedies, there are antibiotics. What are the other things that a physician might use to treat somebody who has some of these symptoms?
So I think what is extremely important, and women are not counseled or educated to a great degree on, is that as women, we are at increased risk of urinary tract infections as we age, particularly when we get into our menopause years. And every year that we're in menopause, the risk of urinary tract infections goes up. And the reason for that being that we lose estrogen. We lose estrogen from a critical aspect of our body, which is the vagina and the urethra. And what estrogen is doing in your body to prevent infections is it is creating acidity. So acid base, it's creating acidity in that area, which helps promote what we call our microbiome or our good bugs or our good bacteria to hang out in the vagina and the urethra. And as we lose that, each year that we get further from menopause, without that estrogen, the tissue in our vagina and our urethra changes. The urethral muscle becomes thinner, the vaginal wall becomes drier, it loses blood flow, it loses collagen, all of those things that keep our skin nice and supple and lubricated, right? So that's why there's all these markets for face creams, et cetera. Guess what? The same thing's happening in the vagina, but what needs to be there is this estrogen. The number one, number two, and number three thing that I want to communicate is that if you are in the perimenopause to menopause age group, so this could be 40s to 90s, 100, and you're starting to experience urinary tract infections, it would be crucial to get on an estrogen cream. There are also other formulations of estrogen, but some form that goes inside the vagina. That can be a cream, that can be a tablet. It also comes in a ring, but that is placed inside the vagina to get that estrogen right to that tissue so that it brings back the acidity. It brings back the balance of bacteria that we want, right? More of the good guys, less of the bad guys, and therefore does significantly reduce urinary tract infections. So we talk about patients having recurrent infections, and that's defined as either 2 infections in 6 months or 3 infections in a year that are culture proven. And so those patients critically need to have estrogen. But for patients who maybe are starting into perimenopause, heading into that menopause phase in their life, I think there's a big role for being preventative. And before maybe you start to get recurrent infections or infections at all, starting on some form of estrogen. And these are all prescription. You can get them from your primary care. If your primary care physician doesn't feel comfortable ordering that, you can see a urologist or a urogynecologist, but these are readily available. They're covered on most insurances. And there's even programs out there, one of them called Pfizer, being a big pharmaceutical company, Pfizer Assistance Program, and they actually provide patients estrogen cream for free, assuming that they qualify financially. And I've had a lot of success for several of our patients with that program. I feel that the financial parameters that they use are fairly wide to capture several patients.
Now, I believe that there are some people who are a little concerned about using estrogen cream or hormones because they're afraid of cancers or some other side effects. What can you say about that?
Yeah, I'm glad you brought that up, Bruce, because that is a big fear. So we've unfortunately, as the medical community, been educating patients around estrogen for 2 decades. And why is that? There was a study called the Women's Health Initiative back in the 80s. And based on a misinterpretation of the data, it was suggested that estrogen caused cancer. And so all of a sudden, you've had women who were taking hormone replacement therapy or estrogen, local estrogen therapy, stopping it because there was this estrogen or there was this risk, fear of breast cancer. Fast forward, those physicians like myself in our field have been actively working to get that concept reversed. And last year, the FDA actually finally removed the black box warning on estrogen because there indeed is no evidence that estrogen causes cancer, breast cancer, stroke, heart issues. And so that black box warning has been removed, which was a huge win. These estrogens are safe. They're the same form of estrogen that you had circulating in your body prior to menopause. The estrogens that we use are the same molecule or same form of estrogen that your body naturally makes. And so it really never made sense to those of us who were in this field as to why one day estrogen is good and the next day it's attacking your body. And the evidence really does not show that or support that. So these are really safe to use. And the benefits are many, not only in terms of reducing urinary tract infections like we're talking about today, but also a big factor is vaginal dryness in women as they get older. And it can lead to pain with intercourse. It can lead to urinary incontinence. And so estrogen in the vagina has many benefits.
That has got to be very reassuring to a lot of people and really encouraging to people who maybe have been considering it, but putting off the idea because they're just afraid that, you know what, there could be some downsides to it. So that's really great to hear. Now, tell me this thing, as this is Life Without Leaks. And so one of the things we always like to do is leave our listeners with a hint, a tip, a strategy, a bit of advice on how to live a life without leaks. Now, we're not talking about leaks today, but maybe there is, if there's one takeaway that you'd like women who are either subject to UTIs regularly or maybe not regularly, or just concerned about it, what is the one takeaway that you'd like to leave them?
I think there's a few things. One, there's a lot you can do to help yourself. So one, drink mostly water in your day. Avoid constipation either being infrequent bowel movements or the consistency of your stool is hard. That also can put you at risk for urinary tract infections. And then definitely speaking to a provider about starting estrogen vaginally, whether that's a cream or pill or ring. Again, there's several formulations, but this really is critical for people who are suffering from them. And then if you do have symptoms of an infection and you reach out, making sure that you're actually getting a urine culture, that the urine culture is showing a significant number of bacteria, and that the antibiotic that's chosen is specific to that bacteria. And if you begin to have multiple infections, 2 in 6 months, 3 in a year, definitely getting on some estrogen. But if you continue to have these infections, then seeking a specialist like a urologist or urogynecologist to investigate other causes or other treatments. And then finally, the last point I'd want to make is that if you're having symptoms and the concern is an infection and the culture does not show that, know that there are other reasons why you can have pain, you can have leaking, you can have burning. And so that's really probably when you need to also see a specialist, again, either a urologist or urogynecologist, because we really need to tease out, is this overactive bladder? Is this a pelvic pain syndrome? Is there muscle tension? What else could be causing these symptoms? So that being said, not every time you have symptoms that seem to be a UTI, is it a UTI?
That is such a great summary and an action plan for people. So I really appreciate that. Thank you.
Thank you, Bruce. I really appreciate being here today.
Life Without Leaks has been brought to you by the National Association for Continence. Our music is Rainbows by Kevin MacLeod. More information about NAFC is available online at nafc.org.